My name is Jo Evelyn Casey, and I was diagnosed with heart failure in 1989. The very first time I had my heart problems, I felt a heaviness in my arms and my legs, and I was extremely fatigued. That was the only symptoms I had. 2 years later, I had triple bypass due to plaque buildup. And then in the late 1990s, my heart rate started dropping. So I received a pacemaker at that time. February of 2012, I had a major heart attack.
Heart failure is a condition in which the heart fails to deliver adequate blood to meet the body's needs. In congestive heart failure, fluid accumulates behind the heart, in the lungs, and in the other tissues of the body. That creates the condition of congestive heart failure. Symptoms and signs of heart failure can include weakness or fatigue simply from the lack of adequate delivery of blood to the body, shortness of breath due to congestion of fluid in the tissue of the lungs, swelling due to congestion or edema in the lower extremities and in the abdomen. Together, again, all of these constitute the condition of congestive heart failure. Risk factors for heart failure can include the same risk factors for cardiac or heart and vascular disease in general. They can include smoking, high blood pressure, diabetes, high cholesterol, and of course, the ravages of excess body weight, poor diet, lack of exercise.
I never smoked, but I didn't eat as healthily as I should have. I loved fried foods. I indulged in ice cream, all the unhealthy things that a person could eat. And my exercise was very limited. I was a nurse and I was on my feet all day long, and I thought that was enough exercise. After I suffered from the heart attack in 2012, they did an echocardiogram on me. They talked to me about how severe my heart problem really was. When they told me how severe it was like I was hit by a bolt of lightning, because all of a sudden I realized how bad it was this time.
As part of the Trinity Mother Frances heart failure team, we frequently see patients with decompensated heart failure symptoms multiple times a year. With medicine adjustments, we can quickly return them to their home and family. Unfortunately, many times they return to us in a short period of time, often less than 3 to 4 weeks. We know that this group of patients has increased rates of mortality and morbidity the more often they're hospitalized.
When I was discharged from the hospital, the staff explained to me that I must take my medication as ordered. I should exercise, weigh myself daily. A dietitian came and spoke to me, so I basically knew what I had to do with my diet. The main thing was eliminate the sodium.
To recognize if you're retaining fluid, you need to weigh at the same time of day in the same type of clothing. You need to take your medications as prescribed by your doctor, increase your activity and balance it with periods of rest. This will help reduce the fluid retention. If you smoke, you need to stop. Smoking makes your heart and lungs have to work harder to pump the blood to your vital organs.
When I was released after my first heart attack, I was given instructions to cut way back on my sodium. That was my lifestyle until 2012, when I was discharged from there, Mother Frances Hospital. I was told no sodium, no red meat, no fried foods of any kind. And I have been on that diet ever since. When I got back home, I took the salt shakers off the table. I started on this trying to eat no sodium. That is very difficult. I have read more labels than I've ever read in my life on canned foods. I do most of my cooking from fresh vegetables.
If you or someone that you know suffers from heart failure, eating the right kinds of foods is the key to managing your disease. It is very important to avoid the foods that can make your heart failure symptoms worse or cause other serious problems. The main nutrition recommendation for heart failure management is to follow a diet that is low in salt or sodium. Salt or sodium is a mineral that our bodies need in order to survive. However, for someone with heart failure, eating too much salt or too much sodium can make your heart failure symptoms worse and cause serious problems. Eating a lot of salt causes the body to retain water, which makes it harder for your heart to pump blood the way it should. This increases your blood pressure and can lead to painful swelling in the legs, feet, trouble walking long distances, and trouble breathing. Making a few changes to your daily eating habits will help keep your heart failure under control. Following a low-salt diet of less than 2,000 milligrams per day is the best way to manage heart failure. A low-salt or low-sodium diet involves a lot more than just throwing away your salt shaker. Most people don't realize how much salt is in the foods they eat every day. Many prepackaged, canned, frozen, processed, and fast foods are loaded with salt. In fact, just one meal at a fast food restaurant can provide more than an entire day's worth of salt. This is why limiting the amount of fast food and processed food that you eat every day is necessary if you're trying to follow a low-salt diet. One of the best ways to cut out salt from your diet is to start cooking more foods at home. At home, in your own kitchen, you control the ingredients in your meals and the amount of salt added to your food. Instead of salt, try using herbs and salt-free spices to season your food. At first, you may notice things taste a lot different without any added salt. But just stick with the diet for a few weeks and give your taste buds time to adjust, and pretty soon you won't miss the salt at all.
As a primary care provider, it's my objective to help you live a long and fulfilling life avoiding a hospital admission. But if you are admitted to the hospital, getting sent home with new medications can be confusing. You don't know if you need to continue your old ones, or you're concerned you can't afford them. The hospital will communicate with your primary care provider about your hospital stay, so we know if any new medications were started or if any changes were made. They will also help you make a follow-up appointment to see your primary care provider. It's so important for you to keep that follow-up appointment. It will help us manage your new medications, and it will help you avoid being readmitted to the hospital.
I realize how important it is to follow their instructions because it actually makes you feel better. And I actually have more energy. I would advise all who have suffered heart attacks to change their diets if possible. If you smoke, quit smoking.
People with heart failure can lead normal, active lives. They do so by taking care of themselves. You can control your heart failure by understanding your treatment plan and following it closely.